Today we're going to talk about intrinsic strengthening, which I'm really excited about. I think there's a lot of value to this, no matter what athletic population you serve. So we're not going to do an anatomy lesson. You guys are all familiar with these muscles. You remember them from gross anatomy, you remember them from your cadaver studies. But a few pointers we might point out on this slide here. As we speak today about plantar intrinsics, you guys all probably are familiar with the fact that you cannot separate the intrinsics from the extrinsics. In fact, this slide is a good example of that. Second layer, you've got quadratus plantae, one of the intrinsics inserting into flexor digitorum longus. You've also got lumbricals taking their origin and insertion. So I'm going to overgeneralize, if you will, assuming that this is primarily intrinsic. However, it's literally inseparable. And as we talk about some of the studies that I've looked at and evaluated, one of the shortcomings is it's literally impossible to prove that the strength gains that have been seen that I'm going to share with you guys are just the intrinsic. So think of this as a intrinsic presentation, but we're also going to, by necessity, include the extrinsics as well. So primarily we're looking at transverse plane function with the intrinsics as well as sagittal plane function. But I know all of you guys are familiar with biomechanics, and I know you guys know that it's literally impossible to have an impact on one of those planes without an impact on the other plane. So certainly we're going to also be impacting the frontal plane, not just the transverse and the sagittal. But if you look at the primary motions of the muscles that we're going to look at today, these are the two body planes that they are most functional in. So you guys also probably remember this from school. Midstance phase of Gait is when these muscles are most functional. And an important aspect of their work is to stabilize the medial longitudinal arch. And there's a really good paper, a couple of years old. Mark has talked about it, Jay has talked about it. It's known as the foot core system. Patrick McClanahan and associates put it out. And what I like about that paper, and you guys might appreciate it as well, is they make a comparison between the lumbopelvic core, which we're all familiar with and has been a big, exciting topic of strengthening. But these authors suggest that we should be looking at the intrinsic foot muscles as the foot core. And I couldn't agree more with that. The other point that I would make is Jay DeSherry came out in 2010 and pointed out that at this phase of the Gait cycle, we have the highest ground reactive forces. So these little muscles that we're going to talk about are pretty important. As I looked over the literature over the last little while, I found a ton of strengthening benefits for these muscles, but we're primarily going to talk about the strengthening benefits for the athletic population. There have been a lot of diabetic studies, there's been a lot of neuropathic studies. However, we're going to talk about the aspects that are going to be most important to you guys in treating your athletes. So fasciopathy, I know we all see a lot of this. It's probably the thing I see the most in my clinic, and my runners, my walkers, and my hikers. And several of the studies have shown some pretty interesting findings. Two of the studies, one of them that's here, Chung and Associates did an MRI study and found that the intrinsic foot muscle volume in folks with a chronic plantar fasciopathy are actually weak. Chang did a similar study in 2012, which is not referenced here. But essentially that's been a finding in people that have plantar fasciopathy. They've got weak foot muscles. So some of the strategies that you folks might want to be considering are also strengthening of those muscles as well. Altman and Associates followed 200 runners over the course of a year. They compared 100 of the runners ran in traditional running shoes, the other 100 ran barefoot. And they followed the injury patterns of these runners, and interestingly, the barefoot group reported less plantar fasciopathy. So these researchers, like a lot of the other researchers, have suggested that we need to be thinking about strengthening of these muscles as it pertains to our patients who are suffering from fasciopathy. So we're thinking here on this slide, the transverse plane benefits of intrinsic strengthening. So everybody's treating bunions as well, and we have our traditional ways of treating this, but I'd like to throw in one more thing that you guys might want to be thinking about, might want to implement, which is also heavily covered in the literature. You want to be thinking about strengthening your abductor hallucis. We all know that this is an imbalance between the abductor hallucis and the adductor hallucis, and those of you that are surgeons are familiar with releasing the adductor from the sesamoid and the proximal phalanx. My favorite thing to do with these folks is is see how strong we can get their foot and see if we can actually, A, primarily prevent them from getting a bunion to begin with, but once the bunion's there, I think strengthening in the transverse plane is a very, very important thing to do, not just for hallux abductor valgus, but for Taylor's bunion as well. If you think about abductor digiti minimi, in folks with Taylor's bunions, it's weak. The interossei and the lumbricals are overpowering oftentimes, so be thinking about what you can do for your metatarsophalangeal joint transverse plane abnormalities with regard to strengthening. And we'll get into some of the techniques here in just a moment. So if you all are here today at 5:30, you're going to get the benefit of hearing some original research by Adam Kelly. He's an athletic trainer. We've been working very closely with him. He's going to share some really exciting things tonight at 5:30. But some of the other strong benefits for strengthening of the plantar intrinsics have been shown in numerous studies. So if you've got folks that are a little bit deficient, you're certainly going to want to consider getting them going on some of these exercises we're about to talk about. This is perhaps one of my favorite aspects of the recent literature. If you look at the literature in the last 2 to 3 years, there's several studies documenting that foot muscles get bigger, they get stronger when you exercise them. One article in particular I like, especially because it's a podiatric article. It's one of our colleagues, Nick Campitelli, did a nice ultrasound study where he followed runners who ran in Vibram 5 fingers. And like the rest of the studies here, they found on the order of about 7 to 9% in intrinsic strengthening. Perhaps one of my favorite articles that I reviewed for this presentation is the third reference here, Chen. And very, very interesting article. They took a 6-month transition period from traditional motion controlling type athletic shoes to minimal footwear and found not only intrinsic foot strengthening, but as we talked about at the outset, extrinsic foot strengthening on the order of about 10%. So, like Mark and Alberto and Jay have talked about tweaking little things to get little performance enhancements, I think strengthening the foot will pay dividends if you folks can start implementing it in your patient population. The other thing that was going through my mind as I was preparing this presentation is I really hope that you guys get excited about this for yourselves and not just for your patient population. This has been the focus of my work for 18 years. Very, very proud of the strength that I've developed in my feet and the athletic performance that it's enabled me to achieve. So flat feet and pronation, this is another big one coming into our offices all the time. What do we do with this? We're certainly familiar with orthotic therapy and so forth, but I would strongly suggest that you folks consider looking at some of these articles that we're listing here and be thinking about what can you do to strengthen these folks who have flat feet or overpronation. They found several things in these studies. They found that if they fatigue the plantar intrinsics, we had an increase in the navicular drop test. We found from some of the studies that if they anesthetize the plantar intrinsics, the arch drops. There was also a study where they literally transected the plantar intrinsics. So these muscles are intimately related in supporting of the medial longitudinal arch. And the big one that's getting all the attention and the one that I like to focus on most in my clinic is abductor hallucis. So if you see the foot in the slide here, obviously the navicular is dropped a bit, but I also want you to notice the position of the hallux. And this is a big finding in my clinic is when you position the hallux, the great toe in natural position, it has a profound effect on the arch. And this is without strengthening. We could take any one of you in the room today, put your toe in the bunion position, watch your navicular drop, then we could reorient your toe into natural position, and in that moment, with no strengthening, you're gonna have less pronation. So there's some really powerful things that we could be thinking about in addition to the things that we're already doing with orthotics and bracing. And then perhaps my favorite, since I am an athlete and I treat athletes, is there are performance benefits. This particular study was interesting in that they over the course of about 7 weeks, did toe flexor exercises. And they found that horizontal jump distance improved, they found that foot strengthening improved, and they suggested from their findings that cutting maneuvers, sprint sports, and jump sports are going to be particularly enhanced in performance by strengthening of the toe flexor muscles. So the next slide is going to be a review for plenty of you. Jay covered it, Mark covered it. Most of the people that come into my clinic, when I talk to them about strengthening, they're excited about it. They want to accomplish this. But rather than diving in, I look at 2 screening tests, and I would encourage you guys to do the same. If they don't have ankle joint dorsiflexion, I think it's premature to begin getting them into a strengthening program. You guys can recall, origin is typically going to be in the heel. So if you've got limited ankle dorsiflexion, you've got a tight Achilles, I would work on that before I go to intrinsic strengthening. So this is a screening test that you all can look at and see if your patients are ready for a strengthening program. Second one I like to look at is whether or not they actually have the ability to flex or plantar flex at the MPJ. The research is pretty clear that most runners are a little bit short in the Achilles tendon. We've got some studies that we'll show here in a moment. And over the course of 100 years, the research has also pointed out that people that wear footwear with elevated heels and rigid toe springs, which are most of our athletic shoes, are also going to be extensor dominant. So this test here is a nice screening test to see whether or not can you plantar flex at the metatarsophalangeal joint. If you can't, which is the case with a lot of my runners and a lot of my walkers, I don't strengthen them. I mobilize them first, and then I begin strengthening later. So not only is this a nice screening test, this is also a treatment that we have. We call this the toe extensor stretch. It's also known variously as the top of the foot stretch. So that will address the extensor dominance. Flat footwear will address the equinogenic influence, and then you can begin your strengthening program. Yes, Rob brings up a good point. There's a lot of yoga maneuvers that can either enhance what we're trying to do or detract from what we're trying to do. Most of the runners that I see are extensor dominant, so some of the yoga maneuvers that the yoga people like their people to do, I do not recommend. In other words, if they can't get plantar flexion, I don't want them doing more yoga to enhance more extensor dominance, so that would be a good way to start it, definitely. So there's many ways of doing these things. We've had a lot of fun messing around with various foot machines and tools and so forth. We purchase them, we play with them, we show the patients them. But I'm kind of a simple guy, like some of the other lecturers, and I don't like doing machines, and I don't like doing exercises, quite frankly. And I think it was Dr. Grady talking about yesterday how 70-some% of his patients didn't follow through on what the recommendations were. I find the same thing to be true with a lot of these simple rehab things. So ideally, what I like to do with my athletes and with myself is, and we'll talk about that a little bit more, I like to set people up to do this functionally throughout their day. So we'll talk about how do we do that. If you're looking at building strength in the transverse plane, abductor hallucis, abductor digiti minimi, interosseous lumbricals, you've got several options. You can do an active system like the melt system where you're actually engaging these muscles. Or you can do my favorite method, what I've been doing for the last 18 years to rehab my own foot, is you can put on some form of toe separator in an appropriate footwear selection and spend your day like that. If you line up the origin and insertions, these muscles will get stronger on their own. You don't have to do anything fancy. So that's my preferred method of addressing the transverse plane component. So interestingly, a lot of the studies that we're looking at intrinsic strengthening, we're accomplishing that from the position that you guys are going to see in your left-hand slide. So in other words, the metatarsophalangeal joint is dorsiflexed approximately 25 degrees, and they encounter that position down to neutral. And what a lot of the researchers have suggested is that we're really actually strengthening the extrinsics more. And the other thing I'll point out is for those of you that are intrigued by this or interested in this, want to bring this about in your patient population, think about the rigid toe spring that's included in most of the athletic footwear. And the point being, if the shoe has got a rigid 25-degree metatarsophalangeal joint dorsiflexion angle, you're not going to strengthen in that shoe. So we'll show a couple of different shoes that might be appropriate for bringing that about. So this is a pretty popular one. You guys have probably heard of this by now. It's also called doming of the foot. And essentially, as you can see from my foot here, I'm engaging my plantar intrinsics. I'm shortening the origin to the insertion, the arch is lifting, and one of the very potent things I hope you can appreciate from this slide is the metatarsophalangeal joints are also lifting. I consider the medial longitudinal arch from the heel to the distal phalanx, although a lot of the literature tends to like to consider the medial longitudinal arch to the head level. So this is a very potent one. I do this all the time. If I'm standing in front of the elevator, I'm doing this. If I'm standing just about anywhere, I'm doing this actively. So this is a very helpful one. Many of the studies that we looked at showed strength gains from doing this exercise, but in keeping with what Mark said earlier, if you really want to get the most benefit out of this, you need to be single leg stance. And there were also several studies that showed that if you really want to get the most bang for your buck, you're not only going to want to be doing this exercise, you're also going to want to be strengthening your gluteals. So if you do both of those together, you're really going to make a huge improvement. Second exercise I love was also talked about in the literature, particularly as it pertains to transverse plane problems, hallux abductor valgus Taylor's bunion, known as toe spreading exercises. And there's many ways described in the literature. Some people start from the fifth toe and go medially. This is my preferred method here. This is how I actually was successful in reversing my own bunion, is I ground the hallux, as you can see here, fan out the rest of the toes and let the foot down. This is called toe spreading exercises. This is getting your abductor digiti minimi, your abductor hallucis, interossei, and lumbricals. So if you really want to strengthen your intrinsics, you got to be thinking about getting the distance between the heel and the forefoot shortened. So one of my favorite things to do is to walk on the beach or run on the beach. So if you're considering the right hand slide, the foot that's on the beach, that would be the foot that's doing the intrinsic strengthening. If you look at a footprint in the sand, you're typically going to see the heels low and the toes are low. So this is a very good exercise to do. So a few hindrances or obstacles to having strength, particularly in the transverse plane, is a traditional tapered toe box. And I've taken some time to look around at the audience members and people that are at this seminar, and most of you folks are in this position right here in the room right now. So again, you're not strengthening your transverse plane, you're actually weakening your transverse plane. So if you want to strengthen it, we really need to be rethinking the width of the footwear being at the ball of the foot. True natural width needs to be at the ends of the toes. That's natural human foot anatomy. So be careful about your toe boxes. That's where a lot of our problems originate. Another big problem is elevated heels. Now, one of the studies, the first study that we mentioned there, took a group of ladies. One group was on a 2-inch heel, the other group functioned from a flat plane. They followed them by MRI, and they found 13% shortening in the 2-inch heel group. So a lot of our athletic shoes are an inch, inch and a half, so you can bet there's some shortening going on there. Correspondingly, over the last 100 years, several researchers have pointed out that if you elevate the ends of your toes above the ball of your foot, you're going to create some extensor dominance. So again, if you want to strengthen your intrinsics, we have to think about origin to insertion getting shorter. I'm going to show one of Jay DeSherry's slides in a moment. He talks about length to tension relationships, which I think is so critical. If you can envision how the intrinsics are functioning in a shoe like this, they are being dominated by the posterior group and by the anterior extensor group. So again, if you want to strengthen while you're out and about, which is my favorite method, we got to be getting the heel level with the distal phalanx all the way out. Everything needs to be flat and level to put those muscles in their length to tension relationship. So as I looked through the literature and the shoes that they were talking about getting people strong in, is this type of a shoe here. And the conclusions were, if you use a more minimal shoe and activate these muscles, they're going to get stronger. But the flip side of that conclusion that I think most of us can achieve is this kind of a shoe, you could look at it as a weakening shoe. So if you really want to engage these muscles, we need to start using them. If you're in a shoe like this that doesn't bend at all, as Mark talked about, the shoe is doing the work for you. And I used to run in these kinds of shoes, and I was always injured, and I couldn't figure out why. And so I think a big part of it is really getting people moving a little bit better in a slow fashion. So the 2004 McClanahan article talked about this factor here. If people are hurt, we immobilize them, but we get them well, we start strengthening them after their injury is over. So that's something we want to be thinking about too as we apply some of these interventions to our patient population. So if you want to strengthen in the transverse plane, you've got to be thinking about a shoe that's got a toe box that enables the toes to spread and spread wider than the ball. And that's critical. Even this shoe, it's better than most of what's out there, but it's still not perfect. So you want to be thinking about your width. It doesn't want to be at the ball, it wants to be at the ends of the toes. If you want to get the origin to insertion at the right length, you need the heel to be level with the toes. This is a good example of a shoe that does that. This is Jay's work to the side, page 41 in Jay's book. He talks about length to tension relationship. If your heel is elevated and your toes are above the ground with a toe spring, you're not strengthening. You're weakening the plantar intrinsics and you're creating dominance in the posterior chain and the extensors. So again, we need to move our feet to get them strong. If we immobilize them, if we brace them, we're not getting stronger. And that's not to say that that's not appropriate at times, but if your goal is strengthening, and I hope it will be for everybody here after you hear this discussion, we really got to be moving ourselves in meaningful ways. So here are the benefits that I encountered for the athletic population. Muscle volume and muscle strength get bigger, get better. So we're getting stronger as we're implementing these strengthening programs. You're going to hear more from Adam Kelly this evening about balance. And this plays into everything, every sport, every move. We need to have balance. We need to have single leg balance. Strong intrinsics support the plantar fascia. If I had a plantar fascia patient on Monday, I'm going to get them going on strengthening. I'm going to get them going on this kind of a program. We can strengthen the arch too, the medial longitudinal arch. We can actually enable it to support itself if we particularly get the abductor pallus stronger. Supports natural gait, and my 18 years of experience working with this kind of work has shown that it's also extremely powerful for preventing and reversing Taylor's bunion and bunion formation. So how do we do this? As I mentioned before, I don't like expensive machines. I've got some good friends in the audience here who are physical therapists. I love them, but I don't want to be in their office on machines. I want to be running in the forest and doing things that I love to do. So what I try to get people to do is set themselves up in strengthening footwear and start living your life like that. In your home, take your shoes off. When you're on a controlled surface, start taking your shoes off. Start working your way down to a minimal shoe. So this is a continuum, and our patients are going to be at various levels of this continuum depending upon where they're at and what their injury is. But again, if strengthening is your goal, we need to be moving in the direction of minimalism and barefoot. So in conclusion, what I've discovered from the research is the best outcomes for these strengthening exercises are to move naturally, and we need to be weight bearing. So you're going to get some benefit from non-weight bearing, but if you really want to get the bang for your buck, you've got to be on your feet, particularly single leg stance. Again, supportive footwear is not accomplishing strengthening. So you want to be rethinking what your goals are if you're sending your folks out to get the Brooks Beast in a similar type of immobilizing shoe. Same thing with orthotics. You got to be really considering what is your goal. Foot movement, naturally shaped footwear equals plantar intrinsic strengthening. So I have a lot of people to thank. It's been a great journey putting this presentation together. I had a great team, and I couldn't have done it without all these people. And we're going to be here for the rest of the weekend. I know some of this is new to some of you folks, so we would love to chat it up more with you. We're also going to have references available. I know some of you are going to want to dig into the research and see what we've found. But feel free to come by the booth. Feel free to grab me. I'd be more than happy to chat about this. It's my favorite thing to talk about. Thanks very much.